Okay, perfect. Hi, everyone here and everyone online. I'm Alicia Wolf, also known as the Dizzy Cook, and we want to thank you all for coming today. Dr. Bay is running a little bit late in traffic, so he's about 5 minutes behind. So if you can just bear with us, he will be here soon and we'll start the presentation. But I thought I would just share a little bit about my story in case you all don't know me or you're not familiar.
Let me,
A little over 6.
why don't you let me, sorry to interrupt you. I'm going to start.
Oh yeah, please
Okay.
introduce.
Yeah.
Yeah.
So hi everyone. I want to welcome you this evening. We're just a little bit, prolonged here because we didn't expect things to quite go like this. But I would want to take a moment to introduce myself. I'm Shirley Kessel, I'm the executive director of Miles for Migraine, and I want to welcome you to this amazing event that we have this evening. And Dr. Bay will be with us shortly. But in the meantime, I want to take a moment to let you know a little bit about Miles for Migraine. And before I do that, I want to thank our sponsor this evening because without their sponsorship, we could not bring you this program, and that is gammaCore. So thank you to them. They are the makers of gammaCore, which you actually will hear a little bit about this evening. And I want you to also know that Miles for Migraine is not just an organization that has races. We also have online support groups. We have all kinds of other educational programs similar to this one. We have an advocacy training program. If you're interested in learning to be an advocate, which is an important journey, uh, if you are someone living with migraine, it's important for you to understand that advocacy needs to be part of your treatment plan. And that's how you're going to continue to get new treatments and get your current treatments paid for by insurance companies. If we all stand up and make more noise as a community, that's how things will change in the long term. That's what has happened with other disease states such as HIV/AIDS and also breast cancer, to name just two. But I want to now take a moment Alicia was so kind to introduce herself, but actually I want to be the one to introduce you, Alicia, because I'm so excited that you're here this evening. I've had a lot of opportunities to work with you. Alicia has done multiple cooking events for us. We do have social events online, so go to our website and check it out. She'll be doing a holiday event coming up soon. But let me just tell you a little bit more about her. She is the owner of the Dizzy Cook, which is a diet and lifestyle website for anyone living with migraine. She's an ambassador of the Vestibular Disorder Association and a patient advisor for Miles for Migraine. She also contributes articles on Migraine Again and Healthline. After struggling with chronic vestibular migraine, Alicia realized there were not many upbeat resources for people following a migraine diet or patient information on VM, also is vestibular migraine. So she created the dizzycook.com. Her mission is to pass on critical information so patients do not have to see 7 different doctors, we all can relate to that, to be diagnosed and treated. Alicia is the author of
Traffic is terrible.
The Dizzy Cook, Managing Migraine with more than 9 comforting recipes and lifestyle tips. We got a lot of background. Oh, there's Dr. Bay. I'm reading on and on. Hi, Dr. Bay. Okay. Well, let me just tell you a little bit more about Dr. Bay, who obviously needs a GPS, I think, or something. But Dr. Bay,
closer to Dallas.
wait, let me just introduce you so at least you can have a moment to breathe. All right. He's the founder and director of the Bay Center for Vestibular Migraine Disorders, a holistic healing center providing patient-centered care, a fellow of the American Academy of Neurology, the American Headache Society, and the Royal Society of Medicine. Dr. Bay has contributed numerous scientific articles to the Journal of Neurology and neurologytimes.com over the last decade. He has been named one of D Magazine's best doctors for 2021. Dr. Bay has always had a fascination for the vestibular system. He spoke about vestibular migraine at the Vestibular Disorders Association, VITA, also known as VITA, Annual Vestibular Conference in 2022. He is the author of Victory Over Vestibular Migraine, the Migraine Manual, and co-author of the now released The Mediterranean Migraine Diet, a science-based roadmap to control symptoms and transform brain health. And before I let you guys speak, we've promised that one of the first people to log on this evening was going to get a copy of the new book. And I was already looking at names who were in the waiting room. And so I'm proud to announce that Bob Lipkowski is the winner of the cookbook. He was the first one in the waiting room. And so, Bob, I am going to chat with you in the chat. If you're still there, I hope you are. I'm going to need to get your address, and I will send you a little note right now, and you can write me back. And without further ado, welcome Dr. Bay and Alicia Wolf, the Dizzy Cook.
Thank you, Shirley, and to everyone who's here live that I'm sure didn't hear any of that. We'll kind of reintroduce ourselves a little bit. So I hope everyone online doesn't mind. So basically, I'm Alicia Wolf. About 6 years ago, I got really sick, had constant dizziness, vertigo episodes. I didn't know what was going on. I felt like I was walking on marshmallows, or like the ground would fall out from under me. I was in watch design at the time and ended up losing my job just from being so sick. It got to the point where I couldn't drive. And I saw several neurologists around Dallas who were supposed to be some of the best, and no one ever mentioned migraine to me because I wasn't experiencing head pain. I just had all the other symptoms like light sensitivity and sound sensitivity. And so my husband actually drove me 16 hours to go to the Mayo Clinic to see an ENT there because it was suspected I had a perilimb fistula. So we saw an expert on perilimb fistula there. And this was after living with this disorder about 6 months and trying vestibular therapy and everything else. And I kept failing all these treatments. And he looked at me, he says, "You have migraine." And I said, "No, I don't have migraine. I don't have headaches." And that's what I thought migraine was, just a really bad headache. And it turns out it's like, "I can't treat you. You need to find a neurologist who can treat this." But it's a type of migraine called vestibular migraine. Well, it turned out that week that I got a call from Dr. Bay's office at UT Southwestern, and they had fit me in, and I saw Dr. Bay, and he immediately diagnosed me. Well, after about an hour of testing, not immediately, but he went through all my history of symptoms and everything, and he said, "Yes, you have vestibular migraine, and this is kind of how your MRI presents with migraine as well." And it was the first time I ever saw a physician that I felt very validated by, and that I felt actually listened to me. And I think a lot of us who deal with migraine we either play down symptoms, or we don't realize how terrible it can get and how debilitating it can get. And a lot of doctors treat us that way as well. They don't take it very seriously. Or they put down symptoms, or they just don't know how to diagnose vestibular migraine. So I'm really happy you all joined us today. We're going to go through some of the treatments that have helped me personally. I want to thank Dr. Bay because he was the big reason that I got my life back. And through all of this, I was very depressed and kind of lost who I was, because who I was wrapped up in my career in watch design. And so when I lost my job, I just sat at home and I was like, what am I going to do with myself? Who's going to want to hire me? And I really found, I've always loved to cook, and I've taken cooking classes all over the world, but I never really translated that into a career until I started just doing it all the time because I was at home, and it gave me like a new passion and something to get excited about at the end of the day, because I knew that even dealing with migraine all day and dealing with insurance companies and talking to doctors, at the end of the day, I could go home and cook a meal and it would always turn out exactly how I wanted it, and it would be comforting and cozy, and I just would really enjoy that. My family and I could connect over it when I felt so distant. And I noticed at the time there were no resources for patients who were wanting to try a migraine diet. A lot of doctors suggest it, but they kind of hand you a printout and they let you on your way and don't really give you any support on it. So I kind of saw a need for patients to realize, there's actually a lot you can eat on a migraine diet, especially a migraine elimination diet. So I went through that, discovered that I did have some food triggers. Not everyone has food triggers, but for me, it really helped me a lot. And it was the final step along with our treatment plan that got me to 100% days again. So I've had some ups and downs throughout these 6 years, and Dr. Bay has been by my side tweaking our treatment plan. And most recently, I went through IVF to have my first child, and a lot of the symptoms came back, not quite as bad, but they did come back a little bit. And so that's when we added vagus nerve stimulation to my treatment plan. So it was kind of nice. I could take care of my child. I didn't have a lot of the side effects that you get with some of the acute medications for migraine. So we're going to discuss that a little bit today. Do you want to tell a little bit about your history?
Oh, yeah.
Sure. No, we'll jump right
That's what we said.
in.
Let me move the chair so I can face everyone.
Okay.
Oh, there we go. Okay.
Shirley, can you all still see?
I think we can.
Okay.
Yes,
Okay,
yes,
perfect.
we can say.
Okay, so we're going to jump right in. There's a lot of talk about the vagus nerve in the migraine community. What exactly is the vagus nerve?
So the vagus nerve is one of the cranial nerves, right? They number them according to the order that they came up with the skull. So vagus nerve is number 10. Because of the cranial nerves, it goes from your brain, goes down your neck, goes to many different organs of the body. So the word vagus means wanderer, right? That's where you get the old terms for homeless people, vagabonds, vagrants, right?
Okay.
Because they wander around. And so that's where we get the name for the vagus nerve. The most important function for the vagus nerve is the autonomic nervous system. The most simple way to explain it, the autonomic nervous system is the part of your nervous system that deals with all the subconscious stuff. So like currently you're eating, you're drinking, it's working on your digestion, producing saliva, producing tears, many different stuff that you are not usually conscious about. The vagus nerve in the autonomic nervous system, it plays a huge role in the parasympathetic side of things. Again, to simplify things, if you divide the autonomic nervous system into the parasympathetic and the sympathetic categories, the sympathetic one is the fight or flight system. That's the one that gets activated when you're stressed out, when you see something scary, somebody gives you a fright, your boss tells you something horrible, gives you extra excitement on Friday.
Could you please speak a little louder?
Absolutely.
Absolutely.
Absolutely. I will do it. Yeah. And then the vagus nerve is part of the parasympathetic nervous system, which is responsible for the rest and digest functions of the body. So when you're relaxed, you're eating like what you're doing now, it helps you digest your food, break things down, helps you mellow out.
Okay, so what is its role in relationship to migraine?
It's a very complicated one.
Yeah. Okay.
So it's an interesting nerve because there are two big parts to it. There is the part that sends signals from your brain to the organs of the body. And there's a part of it that takes the signals from the organs of the body and tells the brain what's going on, right? In migraine, the vagus nerve stimulation, basically it stimulates the part of the vagus nerve that's in the neck. And that, we believe, alters the activity within the nuclei in the brainstem itself. Probably the most important one would be what they call the nucleus tractus solitarius, where the vagus nerve, the trigeminal nerve, and the vestibular nerve all meet together in that area.
Okay.
Yeah.
Where
So
exactly is that?
it's in the part of the brain that's essential for life.
Oh,
Yeah,
okay.
it's your brainstem. It's the part of the brain that deals with a lot of like your heart rate, blood pressure, digestion, breathing, many different things like that.
So is that why sometimes when we have a migraine attack, we have other symptoms, maybe abdominal symptoms or
Nausea,
nausea. Yeah.
vomiting. Some people get diarrhea. Some people get all sweaty and stuff. Absolutely.
Yeah, but most people don't think of that as migraine symptoms.
Absolutely. A dry mouth, for example, can be
Okay.
one of that too.
Are there any other health benefits to vagus nerve stimulation?
Plenty.
Plenty.
Absolutely. So the vagus nerve stimulation, there are many ways to do it, right? Not just with the gammaCore device. So the vagus nerve gets activated when you exercise, when you meditate, when you pray, when you chant, activated. That's why we're relaxed when we perform those things. So it's essential for relaxing the body. It can help with gut health. Now, it plays a big role in the whole, I think was it the Migraine World Summit or also Migraine,
Yeah.
where they talked about the gut-brain axis?
Yes.
Right? So the gut-brain axis is another interesting one, and the vagus nerve probably plays a huge role with that, right?
Okay.
So it connects the brain to your gut and your gut to your brain. And so, signals from the gut can influence the brain's activity, and the brain's activity can influence, the gut health itself. So stimulating the vagus nerve either with the devices or by certain activities, I think would be very important for health. They can also modulate inflammation within the body. I think the latest one is they're looking at possibly a long COVID to see whether vagus nerve stimulation could potentially help with long COVID as well.
Yeah. Okay. Yeah, I think gammaCore is actually performing some studies now currently on that. So I don't want to speak for them, but there have been some studies on it. So you mentioned some natural ways to stimulate our vagus nerve besides just the device.
Yep.
What are those?
So the one I'm sure some of us clinicians are familiar with would be carotid massage, right? It's part of the CPR thing, but no one really advocates for that anymore because if you rub too hard, you may dislodge a clot, which will cause a stroke. Not good, right? I think.
Okay.
Stroke still not
No.
good. So that was one of the old ones. Another one is to basically perform the Valsalva maneuver. So Valsalva is when basically you close your mouth and then bear down, kind of like when you're constipated.
Oh,
When you're lifting something heavy. I mean, you can do that without having a bowel movement, right? So close your mouth, close your nose, try to bear down as hard as you can, and that can increase vagal tone. Another one is to dunk your head in ice water.
The head, not just your
face.
body.
No, your body too.
Okay.
Exposure to cold.
Okay.
So you can dunk your face and your head in ice water. Of course, try not to drown. And that also can activate the vagus nerve system.
Would like cryotherapy be an option?
It could be rather
Okay.
expensive one.
Oh yeah, it is.
Yeah. Ice water, probably a little bit cheaper than
Okay.
cryotherapy. That's another one. We mentioned earlier something about chanting and meditation.
Yeah.
It could be that it helps the vagus tone by altering your breathing patterns. So when you slow your breathing down, you be more conscious of your breathing, about 6 breaths per minute.
Okay.
That's usually the one that tends to activate the vagus tone. So I think there was an interesting study, I believe, out of NYU, I believe, where they showed that when you pray the rosary, it actually slows your breath to about 6 times per minute. And so, that's why, certain things like chanting, religious stuff, tends to help relax the person, put you more at peace.
Okay, that's really interesting.
Diet too.
Diet too. Yeah, we're gonna cover that in a little
Later.
bit. So how can vagus nerve stimulation be used for prevention and acute treatment of migraine? Is one more effective than the other?
Meaning, is it more effective for rescue versus prevention?
Yes.
I don't think we have the data for that to compare whether it's more
Okay.
effective for one. We can help in both, so why not use it for both?
Yeah. Do you see more success in patients with one or the other?
I see both. I mean, the
Okay.
study that we did UT with vestibular migraine was mainly in rescue. Because
Okay.
it was easy to do. Somebody comes in with a vestibular migraine attack, zap them on the neck,
Yeah.
see whether it gets rid of the attack or not. Right. I think the studies there's no study done in prevention for vestibular migraine. The studies was done in migraine.
Okay.
There was one study that was done in triple PD.
Oh.
To show that 3 times per day at least seems to help with migraine prevention and help triple PD as well.
Really? Okay, that must be fairly new. That's really
Yes, it is.
interesting. Yeah.
Yep.
Okay, good to know. Yeah. So a lot of people with VM tend to have triple PD, which maybe you can explain just a little bit, a short
Absolutely.
Sure.
So
What
what's a
triple
quick-
PD is.
Quick segue. So triple PD is basically one of the conditions where you feel dizzy all the time, right? So it's basically you feel this kind of off, lightheaded all the time, and then when you have that with DM, what happens is you have this baseline of constant dizziness. Superimposed on that, you have these attacks that come and go.
Yeah.
Right. So that's in a nutshell.
No,
That'll be
that's,
another topic.
that's really
Yeah.
helpful because I think
gammaCore.
that's very confusing for the community is how do I distinguish between BM and triple PD? So you kind of got a little answer there. How does vagus nerve stimulation stop acute pain?
Again, so going back to the brainstem where the vagus nerve meets the trigeminal nerve, meaning the vestibular nerve there,
Okay.
we think most of the activity occurs there,
Okay.
where you stimulate the vagus nerve that alters the activity in the brainstem and that shuts down the pain signals in the trigeminal system.
Okay. So for my experience, I haven't actually had a vertigo attack. My most recent vertigo attack was actually when I was giving birth, which was great timing. But before that, I hadn't had one since we really started our preventative treatment. Now I do get really bad dizziness, or sometimes nausea, or I'll just feel very overwhelmed by things. And I notice that when I sit against a wall with a flat background and do my deep breathing, that tends to calm everything down. So I'm wondering if that's just me activating my vagus nerve, basically.
Part of it.
Yeah.
Part of it. Yep.
Okay.
Another part is the grounding part, right?
Okay.
So you would just sit against something without a solid back.
Yeah.
Then you have the proprioceptive signals that come in and tell your brain, okay, calm down. You're not really moving. You're not spinning. You're not tumbling.
Yeah.
It's okay. And then it takes it up. That's like
Very helpful for
Yep.
people with vertigo. Well, you kind of covered this a little bit, but you've done a study on using gammaCore for vestibular migraine. Can you elaborate on what you found?
so. There were two parts to it, right? The first part was we looked at the one that we published looked at the effect on vertigo and headaches,
Okay.
right? So patients who came in with in the midst of vestibular migraine attack, we zapped them and see what happened, right? A lot of the patients, the vertigo got better and the headache also got better, right? So that's a simple one to do. So but then the argument there would be, maybe it's a subjective thing, right?
Yeah.
You zap somebody on the neck, they may feel better after that, right? Could be placebo. But then we followed up with one where we looked at, I believe, 4 patients. So
Okay.
they came in during the vestibular migraine attack. They also had nystagmus. Right? And then we looked at the nystagmus before, zapped them with the gammaCore, vertigo got better, nystagmus also stopped. So
Oh.
that one, you cannot really argue that that's a placebo effect because you really cannot fake nystagmus.
Can you explain what nystagmus is
Ah.
for 3/4 of our audience?
Absolutely. So nystagmus is the involuntary oscillations of your eye. There's a very simple way. If there's an imbalance in your vestibular system, that will cause your eyes to jiggle, right? Because to correct for the imbalance, what we'll do is the eyes will drift in one direction, and another part of the brain will say there's something wrong, it shouldn't be there, and it will correct it. So that's the jerky movements of the eye.
So that can translate to symptoms for, A
Absolutely.
lot
So
of
people will perceive oscillops, meaning the jiggling of your environment.
yeah. Who might benefit the most from vagus nerve stimulation?
Everyone.
Everyone.
Everyone. Right?
So for me personally, why I chose that treatment was postpartum. I wanted, like I said before, I wanted kind of a treatment that I would have minimal side effects with, if any.
Absolutely.
That wouldn't kind of slow me down. Some of the medications that are really effective for me make me very drowsy and tired. And when you have a newborn, that's not exactly great. There also tends to be some issues with breastfeeding or during pregnancy. And although gammaCore hasn't been approved during pregnancy, it is something you can discuss with your OB. Mine has approved it currently for me. So it could be an option for people who are.
On that point,
Oh, go ahead.
so although I know they didn't test gammaCore directly in pregnant women,
Yeah.
and so I'm sure if your company says you cannot use it in pregnancy because they don't want to get sued.
Yeah.
Right? Always important not to get sued. Right? But if you look at the data from our epilepsy folks, so in epilepsy, the vagus nerve stimulation has been around for a very long time. The theirs is a little bit more invasive. They implant the device and then it wraps around the vagus nerve. Pregnancy data shows that to be pretty safe.
Okay.
And so that device is shown to be pretty safe. I would imagine The
Yeah.
gammaCore device should also be quite safe.
And it's nice that it's not implanted in, yeah, I like that. Are there people who shouldn't use gammaCore?
Yes. So if you have any metallic hardware in your neck, don't use it. If there's any metallic hardware in your hip, don't use it.
Okay.
If you have a pacemaker, don't use it. So remember the biggest nerve, parasympathetic nervous system, rest and digest. It does slow the heart rate down a bit.
Okay.
So if you have a low heart rate, it may not be a good idea to use it.
Interesting. Okay. So I'm going to actually show you how I use my gammaCore device. Really quick, I usually do 2 stimulations on one side. And so I'm just going to do it, kind of describe it. Maybe you can help me because this is, you know, they give you a little bit of gel, electrode gel.
Make sure you use the gel.
Yes, make sure you use the gel, otherwise it won't work. I'm just going to turn it on right here. Should probably have a napkin, but that's okay. Okay, so I'm going to turn it up in intensity. You can kind of see it going up to about 12. I like to start. And then I am bumping it up in intensity, just kind of putting it along. And I feel it. Yeah.
Yep, got a pull.
So maybe you can talk.
So the lip pulling that you see is indicates that you are getting the right intensity. You don't want to, put it at such a low intensity where you don't get anything, because then it doesn't stimulate the vagus nerve enough. So you see the little lip pulling on the side. It's not a bad thing. I've had people ask me whether it's permanent. It is not. So your face will not be stuck that way. But it's a good sign that it's the stimulation level is adequate. Yeah. I've tried it on myself. I've turned it all the way up to 30. Lots of pulling, but not too bad. Yeah.
Yeah, I feel the pulling.
Yep.
So basically all I'm feeling right now, besides my lip pulling, is I can feel kind of a tense sensation in my neck and some buzzing, but it doesn't hurt or feel uncomfortable.
Tenseness is the pulling is due to the platysma muscle. So there's a
Okay.
layer of muscle in the neck. Basically, it's the muscle that kind of pulls your jaw down a little bit. And so because the electrical stimulation has to pass through the muscle to get to the nerve, the muscle gets activated as well. And so that's why you get a little bit of the pulling and the tightness.
Okay.
Yeah.
Is there anything else? Does anyone have any questions? This is our last little, if anyone in person has any questions.
I'm back. We have a lot of questions.
Okay.
I'm gonna start reading some of the questions, and I'm gonna ask your very nice audience there if they can try to be a little quiet with their dishes. I bet the food there is really good. Hearing some dish clanging, that might be helpful. Okay, so let's get started on some of these questions. So I guess this is for Dr. Bay. Do you have patients with I should know how to say this, dysautonomia and migraine? Thank you. Who have used the vagus nerve stimulator and their symptoms improved along with migraine?
Got it. So question is, do you have patients with dysautonomia? You use the vagus nerve stimulator and have improvement of their symptoms as well? Not off the top of my head, but I don't do it. There are a lot of patients who have POTS and migraine, other types of autonomic nervous system issues too. Off the top of my head, I'm not aware of any that have benefited from the gammaCore just yet. Now, we have to be a little bit careful too, because some, like you say, the heart rate is low, probably not a good idea to use the gammaCore. Low blood pressure may also have to be a little cautious there. Doesn't mean no, you just have to, I think, exercise some slight caution.
Okay. You know what, actually, Alicia, do you think one of you could put the phone a little closer to Dr. Bay?
Yeah.
Sound quality could be a little better. Maybe that would help. Just so we could, maybe you guys could pass it back and forth. Because I have a feeling a lot of these questions are going to be for Dr. Bay. So here's another one. Can you tell me more about visual snow and how it's connected to VM?
unconnected to the vagus nerve stimulation. But so visual snow is a very quickly, it's a neurological disorder, basically where you see like that static in your vision. Most common cause of visual snow so far that we see in our practice would be migraine. So vestibular migraine doesn't mean whether it's vestibular migraine or migraine with the headache, but both conditions we do see patients with visual snow as well.
Okay, thank you.
Does anyone in person have a question that they'd like? No? Okay, we're good.
Okay, I got plenty of questions here.
Okay.
Okay, so somebody wants to know if the gammaCore device has been found effective for people with migraine and have vestibular migraine without the spinning episodes. This person says that they have VM, they always have pressure in their head, a constant dizzy, off balance feeling, and get really bad migraine attacks without spinning dizziness. So,
got it. So summarize, do you need spinning dizziness for the diagnosis of vestibular migraine? Answer is no. Right? In the study that we published as well, you can experience any type of dizziness: spinning, tumbling, rocking, falling, floating, swimming, all kinds, anything you can imagine, sliding as well. Many different things.
okay, and it's also obviously the gammaCore device is not just indicated for vestibular migraine, it's also indicated for other types of migraine. Can you talk a little bit about that?
So it's FDA approved, or FDA cleared rather, for migraine headache treatment, not vestibular migraine. But as with nothing is FDA cleared or FDA approved for vestibular migraine. Yeah. We poach a lot of it from the migraine world and we introduce it for our vestibular migraine patients. What works for people with migraine seems to work quite well for people with vestibular migraine. So we learn our lessons from there. We take it and we apply the same lessons.
Okay, yep. Great. And also, I'm just going to put in the chat right now that there's a link to the gammaCore website. Somebody wants to know how can we get it more affordably, and I think I wanted to answer that question and just say that there's a coupon code that we're offering tonight, and unfortunately, one of the problems that we face in this community is that insurance companies do not pay for medical devices, and one of the reasons they don't is because we have to advocate more fiercely for these types of things to be paid for. We are entitled to these devices. We're entitled to better treatment. The only way we're going to get it is if everybody starts to advocate. And you can do that by coming to a Miles for Migraine Walk, Run, Relax. We have one in Dallas. We have 24 in the country. You can do it virtually. You can come to Headache on the Hill. There are a lot of things you can do. So I won't get on my soapbox and start preaching, but there's a lot of you on here tonight. We do need more people to learn more about advocacy. All right, so let me switch to another question.
I will say, just to stop you for a second, I have had more people approach me lately saying their insurance has covered it for them.
Okay, great.
So I don't know how they're having this. They're from different insurance plans, but it seems to be if you are the squeaky wheel, sometimes you can get that worked out as well. So it's worth checking. Doesn't always happen, but worth checking.
Great. That's a very good point. And you can always tweet at your insurance company, which I've known other very strong advocates to do that. Okay, so somebody wants to know, is there any risk of damaging the vagus nerve from short or long-term treatments such as gastroparesis, indigestion, low blood pressure, involuntary muscle movement, and how does it not damage the nerve?
That's an unusual question. So the question is how gastroparesis can injure the nerve. I think it's the other way around, perhaps. So disorders of the vagus nerve can manifest with gastroparesis and digestive issues, not the digestive issues causing damage to the vagus nerve.
Okay.
Yeah.
Okay, thank you. Does Medicare ever cover vagus nerve stimulator treatment? I guess
I have no idea. Does Medicare cover gammaCore device? I have no idea. Maybe.
No.
No.
No?
No.
Okay.
Okay.
No.
No.
More reason to advocate and make a lot of noise.
Yeah.
Okay, so benefits of vagus nerve stimulation versus something like the cephaly.
Oh, that's a good question. I get that a lot too.
So vagus nerve stimulation versus cephaly. You cannot compare the two. It's basically trying to compare, say, a CGRP blocker and an antidepressant. Both work very differently. Both can help for sure. Have they been compared against each other? Answer is no. A simple way to how I decide, which one to recommend a bit more strongly is if a person has, like, say, more facial pain type of issues, then perhaps the cephaly may be a better choice there, right? Or if a person, say, has issues more like with anxiety, issues, say, with digestion, then perhaps the gammaCore may be a better option in those in that case to start off with.
That was why we went with gammaCore for my treatment as well, because I don't get a lot of head pain or facial pain. So where the cephaly stimulates here, it's also, I believe it's like 20 and 60-minute sessions, whereas gammaCore is just 4 minutes total for one session. You can use it as many times during the day. So you have a little bit faster treatment with gammaCore, as well as I had a lot of nausea, vomiting, dizziness, that sort of thing, anxiety with my postpartum anxiety. So that's kind of why I made the decision to go with gammaCore.
Okay, great. All right, I'm gonna try to breeze through the rest of these questions. Hopefully we can get them all answered. What do I do if my neurologist doesn't think there's enough data to support trying vagal nerve stimulation? I mean, I would say go to another doctor. But,
Got it. So question is if the neurologist doesn't feel that there's enough data to support vagus nerve stimulation. So that's the problem in migraine, or vestibular migraine, especially, unfortunately, right? There's not much data to support anything. We don't have any large clinical trials. We don't have anything like that to support the use. If we sit around and we just wait for the data to come in, nothing's going to happen.
Yeah.
So
you might go chronic, or yeah.
Exactly. My philosophy is, as long as it's safe and could be effective, I try it.
Yeah.
Vagus nerve stimulator, whatever stimulator, if it could be effective and it's safe for the person, hey, let's do it.
Again, none of the treatments we tried for me initially have very large studies behind them. They have very small studies. Most of them weren't even applicable to vestibular migraine.
Yep.
And they worked.
Eye drops.
Yeah, eye drops were great. Yeah, the Timolol eye drops were one of my preventatives, and yeah, it worked great for me. So sometimes you just have to branch out and try and trust your physician.
Try new things.
Yeah. We are kind of running a little out of time, so we're going to switch to the book, and then we can come back to questions later on.
okay.
And we can always do it another.
Yeah, and I'm gonna say,
Same as Arizona, we got another one.
Yeah, we do.
we're gonna give another book away after you talk a little bit about the book, and then we also have to give a book away in the room. So
Perfect.
why
Yeah.
don't you talk a little bit about the book, and we can come back to questions in a little bit.
Okay. So quick, we kind of touched a little bit on diet and migraine and how the vagus nerve plays a part in that as well. We collaborated on our book that just launched yesterday. It's called The Mediterranean Migraine Diet, a science-based roadmap to control symptoms and transform brain health. And this came out of I had my first book, The Dizzy Cook, which was really focused on cooking for an elimination diet, particularly the Johns Hopkins migraine diet or the Heal Your Headache migraine diet. And I was a few months postpartum, and Dr. Begg kind of mentioned he was interested in writing a book about diet, but very science-based, evidence-based. And so I said, okay, what would that look like? And we kind of talked about it a little bit. And I was so excited to work with, someone who I really respected, who helped me a lot in my journey. And so we collaborated on this book that is not elimination based. It's more about what kind of foods you should incorporate into your diet to help with brain health. And so you kind of talk a little bit about how some of these foods boost your brain health, memory, help with brain fog, that sort of thing, right?
Yep, absolutely. So, I mean, so many different diets out there, right? You have the cabbage soup diet, you have this diet, that diet, low carb, high carb, full fat, non-fat, everything is out there.
Everything.
But that's the trouble. I think, apple diet, Oreo diet, everything is there.
I haven't heard of that one, but that's
some that
interesting, yeah.
eat cookies and lose weight.
Yeah.
But there's so many different diets, and diet is something that's like incredibly hard to study. Right? There's so many variables to study. It takes a large population, a lot of resources to study something like that. So the one diet that actually has a lot of evidence that works for many different neurological issues, cardiovascular issues, is the Mediterranean diet. There's thousands of years of history behind it, so we know that it really can work. Yep.
Can you tell me some of the basics about a Mediterranean diet?
Absolutely. So low sugar, right? Or too much added sugar, low saturated fat, high in polyunsaturated, monounsaturated fats, so like olive oils, things like that. Low in processed carbs, with high fiber, low in red meat, high in seafood. So those are the very basic aspects of the Mediterranean diet.
Okay. And we kind of took it a little bit of a step farther by mixing in some of the new research with the omega-3 study.
Absolutely.
Do you want to talk about that a little bit?
I'll let you handle that.
So there has recently been a study that came out that showed a balance. Actually, doesn't happen very often that we get diet and migraine studies, but and it's particularly tough with food triggers, as I've seen in my own community. Mine are totally different than someone else's, so it's really, really hard to study an elimination diet specifically. But what they found was that balancing omega-3s with omega-6s, so having high omega-3s in your diet versus low omega-6, tended to decrease migraine symptoms and migraine days. So we take a little bit of that and put it in this book as well, because a lot of people will just say, oh, eat more salmon, but not everyone likes salmon. So we do have salmon in here, but there are also other ways to get omega-3s into your diet besides salmon. So let's talk about a little bit, what made you want to write this book on diet after victory over vestibular migraine?
I think a lot of people ask about diet. That's the thing. Like, what's the best diet for people with migraine?
Yeah.
Elimination diet, can help to an extent, but it's just basically don't eat this, don't eat this, don't eat this, don't eat this.
And it's not long term.
Exactly. And it's not an easy diet to be on, because then, after a while, all you can eat would be grass and tree bark. Right?
Well, that's not my first book, but
That's true. Exactly. Right.
I got some mac and cheese in there.
And so,
No cheese.
no cheese. Fresh cheese.
It has fresh cheese, yes.
Fresh cheese, no aged cheese. And so, a diet that, we tell people, these are the ones that, you should be eating.
Yeah.
I think would be more helpful. And so that's where the idea came from.
Okay. We do talk a little bit, some of the things in the Mediterranean diet tend to be sometimes food triggers for certain patients. Tomatoes, sometimes we cover that, red wine. So we go over that in this book and kind of explain to you how you can balance those things and what would work for you personally. So how to navigate it. Even what was so interesting to me is you talk about tomatoes and how to reduce some of the glutamate content in it, which is fascinating. How did you find that study?
You have to read the book to find
Oh,
out.
you have to read. Okay. Can't give away. Yeah.
Which part of the tomato?
How do you hope this helps patients?
So we want to give you something to follow, right?
Yeah.
Something where you have some guidance there that you can do long term, right? I think it's important that we give some control over to the patients as well. That you are taking some control over your health too. It's not just, you're waiting for your physicians, your healthcare providers to just throw pills at you.
Yeah.
I think it's important that, you have to do, take the effort, exercise is one. And, part of the Mediterranean lifestyle is also exercise, right?
Oh, okay.
And, of course, have a diet that you can follow and recipes from Alicia, not from me. I only know how to boil eggs. So, recipes that, you can use, simple to make the foods too.
Yeah, that's actually a really great point. So I actually recipe tested this book while I was, managing postpartum anxiety, vestibular migraine symptoms that came back, as well as a new baby. So a lot of people ask me if these recipes are easy. It's hard to say because everyone's version of easy is different, but I would say if I can do it during that period of time, they're probably fairly easy. So I hope they're easy for you guys too. A little bit about, another thing I wanted to say too was how I hope this helps patients is to not only give them a follow-up to if they've done an elimination. I know a lot of people are nervous to bring back in foods, and this kind of gives you a good way to go and makes you feel more confident in some of these things helping your health, particularly your brain health. But a lot of it was a lot of these recipes helped me get back to feeling really well again for the second time. So if I hope that they help you as much as they've helped me kind of regain control over my vestibular migraine as well. Some cooking tips for cooking with vestibular migraine or migraine in general. I tend to choose some really easy recipes that are easy to freeze. So either cooking those on really good days that you can freeze for later. So some of that would be in here, some of the soups, like we have a lentil soup and a white bean soup in here that are really, really good to freeze and keep on hand, especially for high nausea days. There's a famous migraine fighting smoothie in here that I've had several readers say have brought down pain or dizziness for them. So it's all anecdotal, but it seems to work for a lot of people. So a few things there. And if you guys just want to email me or go to my website, thedizzycook.com, I'll give you plenty of tips there as well. Or you can attend our cooking class in December too.
Oh.
Yeah. So we'll be doing a holiday meal for everyone. And I think that kind of wraps it up. Oh, you can get the book almost everywhere books are sold. Amazon, your local bookstore, and then I have some signed copies from myself and Dr. Bay on thedizzycookshop.com.
Yeah, and I put the link to your website in the chat. If anyone wants to go and buy the book right now, you can click on that link, go right to the website and buy the book. So we still have some more time left. How about we take a few more questions? And before we do that, we'll give one book away as we get closer to the closing here this evening on the virtual side. Do you want to pick somebody out in the audience? I think maybe you can think of a letter from A to Z, and somebody with that first name with that letter could stand up, and I don't know, maybe flip a coin if there's more than one person.
Is there
pick someone to how do we do that?
Pick a letter, Dr. Bay.
Pick a letter. Q.
Anybody here with a
anyone
name?
with Q in their name? No.
No Q's?
Better pick another letter.
Try again.
Why?
Anybody with the Y?
Oh yeah.
3. You have 3.
Okay.
So of those 3, Dr. Bay, think of a number between 1 and 10. Keep it in your head. The 3 of you with a Y first name.
Just in your name, or is that start?
Start with a Y.
Go start with a Y.
Oh, we have 1. Yes.
One.
Yes. Yeah.
That was easy.
Fantastic. We'll give you that one. shortly.
Okay.
Congratulations.
Yes, yes.
Jessica,
Yeah.
beautiful.
Does
Okay.
anyone in the audience have any questions?
I have a question.
Okay.
How long do you get relief after you use gammaCore, or is it depend on each person?
So I think it will depend,
Why,
right?
can you
So,
repeat the question, Dr. Bay?
question would be how long you get relief after you use the gammaCore. So as with all rescue medications, you want to have relief for at least 24 hours after using your rescue treatment. Whether it's gammaCore, whether it's cephaly, whether it's the medication. So each person is different. If the relief is not very long lasting, and bear in mind you can zap yourself once, 20 minutes later, 30 minutes later, you can repeat the zaps. If it doesn't effectively keep an attack away, then perhaps it's not a really good rescue type of treatment. If it after within 24 hours, if the migraine the attack comes back, then it's probably not very effective.
For me, I experienced almost immediate relief, but the severity of it or the amount of relief that I receive depends on how bad that day is too.
Do you use it before ever as a preventative measure?
Yeah, so I'll use it 3 times a day. I used
Every
to use
day
it 2 every day. And then I used to use it 2, we bumped it up recently to 3. Or I'll use it when I have attacks or really bad days.
I also recommend using it before doing anything that will make you dizzy or make you nauseous. So you can zap yourself before you say going to the store. You can zap yourself before going on the computer. So different things you can do. It's very flexible. I think they limit you to 30 zaps in 24 hours.
Yeah.
Now, I know the
So
company
I've
doesn't
never
like to say
got close.
zapping, but
Yeah.
zap is so much catchier than stimulation.
We have one back there, Erica.
So both my daughter and I both have vestibular migraine, but she also has trigeminal neuralgia. Is that something she can still use with trigeminal neuralgia?
I
Can you
think
repeat,
so.
Dr.
We have
Bay?
our facial nerve expert over here, which will make full use of that. Shabib?
It's not been looked at in trigeminal neuralgia, but you know what? If you want to try it and see if it works for you, there's really no harm unless you have contraindications to using the device. Okay, I'll have to ask her.
Dr. Bay, can you repeat that?
Yeah.
Yeah. So the question was, could you use the gammaCore if you have trigeminal neuralgia? And Dr. Masro's answer, you can try it out, not be tested, but hey, try it out, right?
And I believe you can test it in their office, right?
Yeah,
Can you do that
absolutely.
at UT Southwestern as well?
Yeah. You have the demo?
Still have the demo course.
Hopefully the demo still works.
We will make sure.
Ask your physician, yes.
Yeah, test it out. Test it
Yeah.
out. Like, see. Yeah. Worth a try.
Yeah.
Yep. Yep.
Okay. I think that was all here. There's
Okay,
anything online.
great. We'll transition back to the virtual side here. Can an over-the-counter TENS unit be used on the back of the neck to stimulate the vagus nerve?
Oh, no. So I repeat the question. Can an over-the-counter TENS unit be used to stimulate the vagus nerve? No. So don't do that. I mean, remember we said the vagus nerve controls many important things, right? Heart rate, blood pressure, many different things. You don't want to do something wrong and that stop the heart. Heart stopping, again, not very good. When it happens.
No.
Usually not a very good outcome. No.
Okay, good.
No, so don't do that.
Yeah, okay. Will the vagus nerve stimulator help with PPPD?
So vagus nerve stimulator and triple PD. There was the one European study. It showed that 3 times per day, the stimulation after about 2 to 3 months, it did show a reduction in triple PD symptoms. Yes.
Okay. Can you use gammaCore with a VP shunt?
Can you use gammaCore with a BP shunt? Probably not a good idea. So any implants and all that, don't use the gammaCore. Probably not a good idea to use it.
Maybe try some of the ice dunking.
Ice dunking,
Yeah.
perhaps. Yes, exactly. Humming, ice dunking, chanting.
Yeah.
No, probably not a good idea to stimulate the BP shunt present.
Okay, can vestibular migraine cause heart palpitations?
Can vestibular migraine cause heart palpitations? Indirectly. Right, so if you get vertigo, the natural response to vertigo is you get anxious, you feel panicky, and that can cause palpitations.
Okay. Somebody has vestibular migraine, and is that something that you can see on an MRI?
No, so the MRI does not diagnose migraine or vestibular migraine. Sometimes we see things on the MRI that supports the diagnosis or is consistent with the diagnosis, like spots, right? So a few small spots in the deeper parts of the brain can be seen in people with migraine. It's not diagnostic of migraine, but it's not it's something that we see sometimes in migraine. Yep.
You were the first doctor who actually showed me my MRI, and look at this.
A few little white spots.
Yeah.
Okay. Could gammaCore help with gastroparesis? As I think you already said yes to that, right?
Potentially. I think there's a study that showed that they were testing in gastroparesis.
Okay. What would be considered too low a heart rate for consideration of using gammaCore?
Heart rate. So anything below 60 is considered low heart rate, bradycardia. So, if your heart rate is below 60 or close to 60, I'd probably stay away from it.
Okay. Is it possible to have, when you have migraines, some days include vertigo and some days have actual head and neck pain with no vestibular, dizziness symptoms?
So say again, what's the question?
So is it possible to have migraine and also some days you have vertigo and some days you just have headache and neck pain with no dizziness?
Absolutely. Yep. So you can have some days with headache, some days with vertigo. They don't necessarily have to go together all the time.
Yeah.
Yep.
Okay.
Mine vary all the time.
Yep.
How do you tell the difference between Meniere's symptoms and vestibular migraine?
Symptoms alone can be very difficult to differentiate the two. Ear pressure, tinnitus can happen in migraine, vestibular migraine can happen in Meniere's disease as well. If it's strictly on one side, it tends to favor a little bit more Meniere's disease, but one side can also help would be to get your hearing test. If you have low frequency hearing loss on one side, high chance of that it's Meniere's disease. Vestibular migraine won't cause that.
Okay, thank you.
Hearing loss.
Okay, can you elaborate on why, on developing vestibular migraine, so many foods become a trigger? I used to eat everything before that, and neurologists I saw even acknowledged this or suggested a diet. This, in fact, said, don't restrict any diet at all, but everything I eat triggers me. So I know there's two schools of thought. Eat anything because you're going to get the attack anyway. And then there's a school of thought that says food can be triggering. So how do you know?
So, I think we can bring up a very interesting question. So what happens if all foods trigger a person? So I think the danger that I see in some people is, you can start to develop central sensitization syndrome. We see a lot of people, of course, they have food triggers, right? Mm-hmm. But I think if the person, once you have like long-standing chronic symptoms that have been going on for a long time, unfortunately, you can enter central sensitization where your brain becomes just so vigilant about any changes in your body. So any food that you consume, it makes you feel slightly different, slightly strange, and that causes a reaction to the person. That can be a very, very unpleasant situation. I have had patients who, every single food they feel like, aggravates their vertigo, aggravates their dizziness.
I used to feel dizzy all the time after eating, no matter what I ate, even when I was on an elimination diet. And a part of that was just being in chronic migraine. It can also be blood sugar changes depending on what you're eating too.
Could be your brain has become just so sensitive, even a slight change in the blood sugar, the brain may interpret that as a threat, just, go into that type of a cycle.
And that's why having a complete plan is so important, because I see a lot of people blame foods and they shouldn't, because that's the first thing your brain wants to go to is what did I last eat? But that's not always the case. There's so many triggers in this weather.
Absolutely.
Yeah,
I mean, you know,
Stress.
I tell all our patients the same thing. The food triggers in migraine are not, you know, clear cut, right? It's not like the food laws, you know, it's not like the kashrut. You have the clean, the unclean, the holy, the profane, eat this, don't eat this. If life were that simple, it would be so much better. I just tell them, you know, eat everything with a cloven hoof and the choose on the cut. But, you know, unfortunately, life is not that easy. Right? Everyone is different.
yeah. So sometimes just don't if it's like that, just don't blame the food and,
Yep.
you know, work on your treatment plan, basically.
Okay, good answers. Are there any downsides to using vagus nerve stimulation?
Not really. Downsides, I mean, of course, you know, with low heart rate, if you don't have any metallic implants, shouldn't be a problem. I've had some patients say that they got a bit dizzier after they got the gammaCore stimulation. But I mean, I advise everyone, everything makes people dizzy. Dizziness, headache, constipation, diarrhea, not enough sleep, too much sleep. It's reported as a side effect for every single thing on the
Yeah.
planet. So, not a very specific type of finding, unfortunate, or side effect, unfortunately, can happen.
Yeah.
But it's not, doesn't mean that it will happen.
Okay. Would vagus nerve stimulation help to relieve ear pressure? I haven't heard that before.
If it's part of migraine, yes. So, you know, ear pressure is one of those weird things, kind of like, you know, ringing in the ears, tinnitus, right? You know, migraine can do it, neck problems can do it, TMJ issues can do it, ear issues also can do it. So it depends on the cause.
Okay. Okay, 2 more questions and then we're going to do the book. We're going to draw the book winner. Can you use cephaly followed by gammaCore within the same hour?
Can you use cephaly followed by gammaCore within the same hour? I don't see a problem with it.
Maybe just not at the
Yeah,
same
we
time.
could.
I don't know. That's
I mean-
a lot of buzzing, zapping.
It shouldn't be a problem. I mean, you know, it's not studied. I see one stimulates the trigeminal nerve, the other
Yeah.
stimulates the vagus nerve. Should be okay.
Yeah.
Okay. Can you have 24/7 dizziness with vestibular migraine, and can you have tremors and leg weakness with vestibular migraine?
So 24/7 dizziness with vestibular migraine, yes. Yep, so you can, a lot of our patients with vestibular migraine are dizzy all the time. The leg tremors and weakness, probably something else. I mean, sometimes, you know, you can have a sensation that your legs are weak or a sensation that your legs are heavier than usual with migraine attacks, especially with vestibular migraine. But for the legs to be weak or if there's actual tremor, you may need to talk to your neurologist to see if there's any other issue that could be going on.
Okay.
Yeah.
All right. And now for the moment you've also been waiting for. This was very, very informative. So I want to say this was excellent. Unfortunately, I know our sound quality could have been a little better, but just for everyone still here, we did run into some issues right at the last minute. So here's what we're going to do. Since you've all hung on for so long, and I'm sorry we only have one more book to give away, we are going to do the same thing. We're going to pick, I'm going to have Alicia, if you could pick a letter for a first name between A to Z. I'm going to pick the first person that has that letter.
Okay, I'm going to pick the letter A.
A, okay. So that would be, because some people don't have their last names, Amanda Mercier. Congratulations, Amanda Mercier. We will get your information from Race Roster, and we will, from the registration sign up, and we will, I got to write down your name so I don't forget, and we will send you a book. And I want to say thank you again to our sponsor, gammaCore. electroCore, we did put the coupon code in the chat. If you can please click on that and you can go get the coupon code if you're interested. And also we put the link for the dizzycookshop.com. And also I put the survey here. If you can click on that link before you go and give us some feedback. We know that the sound quality was not fantastic and we apologize for that. This is being recorded. You will all get a copy of the recording, and hopefully that would be useful. And you can listen with some headphones maybe. So with that, I want to say thank you so much to Dr. Bay and Alicia Wolf, the Dizzy Cook, for being here with us this evening. It was fantastic to see you, Alicia. You really look great as a pregnant woman with another baby on the way.
Oh, thank you.
So you're really doing a great job to support our community. And also Alicia will be doing a holiday cooking event for us. So if you, now that you have registered, you'll get the email when that comes out. I can't remember when it is. It's in December, right? I don't have the date up the top of my
It's, I believe it's December the 4th, so it's the first Sunday of December. And we are going to make, I think, chicken Wellington and snickerdoodle truffles. So the latter part, not very Mediterranean migraine diet friendly,
What sugar?
but yeah, lower sugar.
Okay, we'll have a little fun.
Yeah,
with
so,
that.
oh, also, you can contact Dr. Bay. Can you hear me?
Yes.
I don't know if you can hear me. You can
Yeah.
get in touch with Dr. Bay at the Bay Center.
Oh, yes,
Yes.
We'll put it up.
Okay.
Because I couldn't hear.
He's at the Bay Centers for Vestibular and Migraine Disorders. And you can see him online, and you can get in touch with me at the Dizzy Cook on Facebook, Instagram, and on my website.
Okay. And with that, we'll say good night to everyone and thank you for being here. Bye now.
Thank you.
Thank you.
Bye.